Okay, everyone, why don't we get started? And just to welcome you, welcome those on the West Coast, good morning. Those in the other time zones, good afternoon. Again, my name is Andrew Susskind, and I'll be spending the next hour with you talking about emotional sobriety and sexual addiction. And I wanted to start with a quick story, which is about emotional sobriety. Many of you may know that last week's webinar had to be postponed. And I was sitting here exactly where I am right now, and something happened with my computer. And I have to admit, I'm not the most technologically savvy person around. And it was rattling. I was getting ready literally to start the webinar, and it just wasn't cooperating. The technology was not on our side that morning. And so at the time that that happened, my emotional sobriety was out the window. I was in a shame spiral. I was embarrassed. I was sitting here just kind of in disbelief that we were all set to go and then we had to postpone. And you know, the wonderful thing is the person who's been helping from C4, his name is Jesse, was very reassuring to me. He said, it's not your fault. It's something that happens to all of us. Technology doesn't always cooperate. And within about a half an hour, I think I regulated again, and I felt more emotionally sober. And we're going to be talking today about one version of emotional sobriety, which is really something that I've put together through the years. It's also something that's in my book. And we're going to be talking about how emotional sobriety and sex addiction go together and how one influences the other. Okay, so just wanted to start with an example of how we all dysregulate, or we all become emotionally rattled and sometimes not so sober when life throws us a curveball. So the purpose of today's talk is to take a closer look at the challenges that we face working with sex addiction, hopefully to offer you some tools, some strategies, some new perspectives, so that your work with your clients can be a little bit easier and that you'll feel a little bit more equipped by the end of this hour together. As we know, addiction and sex addiction is rampant in our community and in the world in general. And I always say that as much as we know about addiction, even in 2020, even as much as we know about addiction and sex addiction, we still have a long way to go. And so in this hour, we're just going to focus on emotional sobriety. And we're also going to touch a little bit on nervous system regulation, because for me, emotional sobriety and nervous system regulation go hand in hand. And one thing I want to say, by the way, about emotional sobriety is the term is great. I think it's a really interesting term that we're going to define today, but it's more than emotions. And so we're going to talk more about how the mind, body, spirit connection is really a more holistic way of looking at emotional sobriety. So if some of you had a chance to read my bio, I'm an LCSW here in Los Angeles in private practice. I'm a somatic experiencing practitioner. I'm a brain spotting practitioner, and I'm also a certified group psychotherapist. So I wear a lot of hats, and hopefully I bring whatever works best to my clients, whether it be in my individual or group work. But what many people don't know about me is that I've been in 12-step programs myself, and specifically for sex addiction, since 1994, so going on 26 years. And you know, sex addiction isn't just about sex addiction. You know, I consider myself to be a sex addict, a love avoidant, a codependent, and definitely a recovering perfectionist. So actually in my meetings that I go to every week, I identify myself as Andrew, and I'm in recovery in this program, right? So rather than going into the whole 9 yards, I just say I'm Andrew and I'm recovering in this program. And that's how I see addiction in general, really, but sex addiction in particular, is that it's not just about the sex. And that's the name of my book, which I'll talk about later. But anyway, with that said, I also want to say that I look at addiction and I look at sex addiction through the lens of brokenheartedness. And what I mean by that is that actually we all have brokenheartedness. Nobody on the face of the earth is immune to brokenheartedness. So as clinicians, I'm looking at the brokenheartedness of my client, the brokenheartedness of myself, and the brokenheartedness of what's around us. In the world today, we have a lot of brokenheartedness, as I'm sure you know. And I feel the brokenheartedness is really a core of addiction. And our job as mental health professionals is to help our clients mend the broken heart. Okay, so as I'm mending my own broken heart, because I'm constantly working on my own healing, I'm also mending the broken heart of my clients. It's a mutual experience. So the last thing I'll say before we get into the slide presentation is that I really believe that there's still way too much stigma about addiction and way too much stigma and misunderstanding about sex addiction. You know, because in spite of all the knowledge and all the education that we have in the world, there's still a lot of myths out there about what addiction and sex addiction are really about. And I love the expression or the quote that Johann Hari talked about in his TED Talk. He says that the opposite of addiction isn't sobriety. The opposite of addiction is connection. You may have heard that before. I love that. So we might say for today's discussion, the opposite of sex addiction isn't sobriety. The opposite of sex addiction is connection, okay? And emotional sobriety is really about connection. And we're going to talk about that right now. Okay, oh, by the way, before I continue, if you have any questions at all, feel free to ask them in the Q&A box. And I'm going to stop probably about 10 minutes before the hour to see if there's any questions that I can answer at that point. Okay, so we're going to go on with the PowerPoint now. So as I said, today's presentation is really about brokenheartedness, leading to secure attachment. We're going to talk briefly about positive psychology, what I call connection versus disconnection, and of course about emotional sobriety. So, another story to share. So on the left is my husky that I grew up with as a kid. His name was Nicky, N-I-K-K-I. And it's a little fuzzy because I think this picture was probably taken in the mid-70s. And if you can see, he's a brown and white Siberian husky with a clover leaf on his forehead. He was awesome. And on the right is my grandmother Rose. And this is a picture that was taken on the Atlantic City Boardwalk. I grew up in South Jersey. And this is on the Atlantic City Boardwalk. And we used to go, just the two of us, but at times the whole family would go. But just the two of us would go down to Atlantic City together just for the afternoon or an evening together. We were buddies. I can't tell you how amazing and unconditional my grandmother was. And I kind of joke about this, but it's kind of poignant that if it wasn't for my dog and my grandmother, I don't know where I'd be. They were my touchstones. They were the unconditional love. And they were really what helped my broken heart start to mend a little bit. And there's a diagnostic question that goes along with this. So if you're asking a client, who was emotionally reliable in your childhood? Who was emotionally reliable in your childhood? If they cannot come up with an answer, you know that you've got a lot of work to help them develop secure attachment or to help them develop really a stronger connection with trust and love in their life. If somebody can name a few people, a teacher, a family member, a pet, you know that they've already had the experience of unconditional love, and you already know that they know what it's like to be mending their broken heart. So that's always an interesting diagnostic question. You know, who in your childhood was emotionally reliable, or you could say who was most dependable emotionally for you? Okay, so brokenheartedness. Brokenheartedness is something that I did a lot of soul searching about in terms of what are the main areas of brokenheartedness that each of us experience, or that some people experience much more severely and some people experience much less severely. So the different categories that I came up with are very basic in a lot of ways. Oops, okay, here we are. I told you I was technologically challenged. So under brokenheartedness, what I came up with was trauma, of course, either specific trauma or developmental trauma, sometimes called relational trauma, abuse, sexual, physical, emotional, spiritual abuse, neglect, benign or intentional, right? So neglect can be something that somebody does on purpose, or something that let's say they're working 2 jobs and they aren't doing it intentionally, but it's neglect. Abandonment, where a parent physically leaves the child or sometimes dies, can be a form of abandonment or experienced as abandonment. And then lastly, any kind of grief and loss. And that can be through death, through multiple goodbyes, through multiple relocations, anything that feels like grief and loss. So I'm using the term brokenheartedness as a way to encompass anything that really leaves us with that sense of a heart that is trying to process something that's too much to process at the time. And I use the term brokenheartedness, by the way, because although I understand the DSM and I believe in diagnostic language between clinicians, I really like to keep things non-pathologizing. And that's just my own approach to addiction recovery, is to not pathologize, because oftentimes that can be stigmatizing, and oftentimes it can be really shaming in some ways. And I think because a lot of people dealing with addiction are very sensitive, they tend to absorb things and take things on as something wrong with them. So again, we don't want to contribute to the shame that addiction already has inflicted. Okay, so brokenheartedness can happen before the addiction starts, or it can be a result of the addiction, okay? So whether it's the cause or the effect of addiction, brokenheartedness is a form of invisible suffering. And I want to give you an example because I think it's becoming more and more common. In the sex addiction world, porn addiction and different types of addiction that involve the internet are rampant and really epidemic. And nowadays, what I see more than I used to see, because I actually went into the rooms of S recovery before the internet, believe it or not, is with younger folks, like teenage boys, for example, young adult boys or young adult men who get really involved in porn, where they're compulsively using porn multiple hours a day, that kind of thing. They may not have a whole lot of classic brokenheartedness before they got into the porn. Sometimes they do, sometimes they don't. But those who don't have a lot of brokenheartedness, at least how I'm looking at it, and then they get into the porn, become really involved in something that causes brokenheartedness, right? They may skip school. They may get into different kinds of what's the word, where they get cut off from all their friends, where they don't work or lose a job because they're just spending so many hours, they're not even sleeping enough to hold a job or to focus on their studies. So I just want to make this clear that I used to think, once upon a time, back in the 90s, I used to think that there was a correlation between some kind of brokenheartedness, some kind of trauma that caused the addiction or the sex addiction. I don't believe that anymore. I don't think it's a one-size-fits-all answer. I've seen enough clients who develop their addiction who really don't have a tremendous amount of trauma or brokenheartedness in their background. So I just wanted to share that. It's just an opinion. I know different people have different opinions, but that's where I come from with it. So what are the antidotes to brokenheartedness? So for a moment, what I'd like you to do is take your focus to these two lovebirds and just notice what it's like to spend a moment looking at them cuddling on a branch. All right, so just notice what happens in your body, what happens to your facial expression. I kind of smile a little when I see these guys. So the idea is that, as you know, we're biologically wired for connection. We know that at this point. And just like these lovebirds, it's really about intimacy. It's really about connection. It's about emotional reliability. And it's about developing secure attachments and giving and receiving love freely. So I really see these as the primary ingredients to mend the broken heart. And that's really the therapeutic direction that I'd like to take us in today. So as we know, attachment theory, from the time of Bowlby to the time of today's theorists that are working on attachment, it's really a direction that we want to hopefully see our clients and ourselves moving towards. But what I wanted to say, because I learned this recently, sometimes it's so interesting. I can be in the field for so many years, and then I hear something one day, and it's just a little bit different than what I heard a couple years ago. And what I heard is that secure attachment is not about helping our clients build secure attachments, okay? I know this might sound controversial. It's not about helping our clients build secure attachments. It's actually about helping our clients reduce the barriers that they have built against secure attachment. And I know it might sound like a semantic difference, but I think it's really important, at least for me as a clinician, to say, well, okay, it's not all about the secure attachment. I don't have to work so hard about figuring out how to get the client there, wherever there is. But it's more about what have been the barriers, you know, how have our clients defended themselves against secure attachment, and how can we focus on those barriers or defenses? And something that I've carried with me for many years is that we're most defended against our greatest needs. I believe that that comes from the psychoanalytic world, at least paraphrased, but I think it's so powerful, and I say this to clients from time to time, is that we're most defended, all of us, it's the human condition, we're most defended against our greatest needs. So what our longings and needs and desires are, oftentimes we protect ourselves against that. It sounds so counterintuitive, but that's what we're really doing oftentimes in therapy, is helping our clients understand how they protect themselves. What are their survival strategies? What's gotten in the way of them finding some kind of love or connection in some form or another? It doesn't have to be romantic, but often there's a focus on that with clients who come in and are brokenhearted from maybe many attempts that haven't worked for them in terms of finding a boyfriend or a girlfriend, that kind of thing. But I'm not really going to talk so much about love addiction and love avoidance today, but that definitely is a very deep suffering for clients who come in with that cycle that just isn't working for them. Okay, so that's secure attachment. Positive psychology. I hope that many of you are familiar with positive psychology, but I'm going to share briefly something about it because I love positive psychology. I thought it's been a wonderful addition to the dialogue in the psychology and mental health field. And I'm just going to share a little bit about my experience with it. So in 1998, a psychologist at the University of Pennsylvania named Martin Seligman, he became the president of the American Psychological Association. And every year the APA has a theme that goes along with the president and what they want to focus on that year. And Martin Seligman decided that the theme for 1998 was going to be positive psychology. And he coined the term. Nobody had heard it in that way before. But what was so interesting about it is that researchers from all around the world came out as positive psychologists, basically. They were studying things like, as you can see on the bottom, things like well-being and signature strengths and flow, gratitude, forgiveness. People were already studying these things, but they didn't know about each other. So what Dr. Seligman did was he brought together a community of people, of positive psychologists, and it became really a movement and a new dimension of what psychology has been about. And for those of you who know his work, he was the one who studied back in the 70s and 80s, learned helplessness. He studied a lot about depression at the time. And then what happened was in the 80s, he wrote a book called Learned Optimism. And so he flipped it on its side and he said, if we can study learned helplessness, we can also study learned optimism. And things just kind of unfolded from there. And in the 90s and early 2000s, coaching really became again, coaching had been around before 1998, but coaching became a little more specific and had a framework to it. And in a way, and this is just a loose way of thinking about it, coaches really are the people who practice and bring to clients what positive psychology is all about. Generally speaking, positive psychology is about research, and it's about academia and studying what makes life worth living. And I love that expression, because how many of us really stop and ask ourselves what makes life worth living, right? And, or the other phrase is, what gives you a reason to wake up in the morning? Now, you might also know that The Science of Happiness was actually the front cover of Time magazine, I want to say in around 2002, 2003. And so it was really a moment of a wave of something that was taking root and looking at what's right versus what's wrong, rather than looking at pathology or deficits, looking at strengths and talents and what is it that really is going to make life more worth living. And the reason I bring this into our discussion today is because I believe that positive psychology and coaching absolutely have applicability to addiction recovery and sex addiction recovery. And emotional sobriety, although it hasn't been studied, I believe, under the umbrella of positive psychology, if I could clone myself and go back to grad school, I would probably study how emotional sobriety works within the positive psychology framework and how it influences the vulnerability to relapse, because that's really my interest, is how can we reduce the vulnerability to relapse. Okay, so that's just a little bit of a quick and concise view on positive psychology. So I'm going to talk for a moment about disconnection. So how many of you have clients in recovery from out of control sexual behaviors who say things like, no matter what I do, I can't seem to relax? Or I'm constantly anxious, I'm crawling out of my skin. Or when I'm stressed, the first thing I think of is getting high. I know it's not what I really want to do, but I believe it will give me temporary relief. So these are all examples of disconnection. And before I forget, I actually lean in the direction of either out of control sexual behavior as a term or compulsive sexual behavior. Although I think sex addiction is the more frequently used term, I really believe that it's a little bit misleading. And so I think out of control sexual behavior is very descriptive. And the World Health Organization is calling compulsive sexual behavior disorder, although I don't like the term disorder, but they've now come up with a category for compulsive sexual behavior, which I'm really excited about because it's taken many, many years to get there, okay? So that's a little bit about disconnection. So in my book, I interviewed folks about emotional sobriety, and the question I asked was very broad. When do you feel most like yourself? And Susan said, when I'm creatively expressive, when I'm writing, singing, dancing, doing artwork. Robert said, while taking a long walk and being out in nature. Alex said, meditation is a reset button for me. A lot of times I get into a trance of suffering and then want to act out. But when I meditate, it's like I see it. I see what I'm doing and it's painfully obvious. It wakes me up. And Colin said, when I'm consistently working my program, using the tools, when I'm not making somebody else or my job my higher power, when I'm with a friend who sees me and supports me and can be present and reflect with me. And the reason, by the way, that I had interviews in my book is I feel like the people I interviewed said things much better than I ever could. And this is just an excerpt from the book, but this is an example of just some very clear and direct and honest answers about emotional sobriety. And by the way, these are not their actual names. These are all names that I changed. So just to clarify that. So what is connection? What really is connection? And what I say is that it's really a foundation for emotional sobriety. So I look at it this way, and this is sort of the trifecta of connection. Connection to our inner self, connection to others, and connection to some kind of higher power, whatever that might be for you. So it's really like a triangle of self, others, and something greater than oneself. And my personal formula for connection is that I have a fantastic therapist. I have a sponsor that I've been with for many years, and I have a higher power that I happen to call God. And those are the ways that I stay in connection with myself, with others, and with a higher power. So this is a definition. This is just my idea of emotional sobriety. So take what you like and leave the rest. But it goes like this. It's the capacity to experience the fullness of life. By the way, for those who might be taking notes, I am going to be offering my PowerPoint to all of you. So feel free to just write down what you like, but don't feel free that you have to, get a carpal tunnel syndrome as you're writing what's on the screen. So again, emotional sobriety is the capacity to experience the fullness of life. Emotional sobriety is a resilient, resourceful, and regulated state of well-being. And emotional sobriety is when you feel most like yourself. Some people say being comfortable in one's own skin. And ultimately, my interest, my hope is that emotional sobriety, if someone practices emotional sobriety and really works toward bringing this into their daily experience, that it reduces their vulnerability to relapse and to slips. Okay, that's really my hope. So these are the 4 R's, and I like to sometimes come up with things that are easy to remember. So I came up with these 4 R's as a way of thinking about emotional sobriety. Relax, and I'm not just talking about vegging in front of the TV, I'm talking about relaxation as an art, physiologically. Regulate, which we'll be talking about in a few minutes, the nervous system, regulating the nervous system. Respond, which is a mindful way of going through life. Like for instance, last week when I had the difficulty with the computer, I initially was very reactive because it just was a lot to deal with all at once. But within half an hour, with the help of Jesse, the person that's been helping me with this presentation, and with the help of just techniques, breathing and calling a friend and that kind of thing, I didn't end up in a shame spiral the whole day. I was really able to respond to what happened and not get reactive. And then the last and maybe one of the most important R's is relate. And that goes right back to what we were talking about: connection to self, connection to others, and connection to a power greater than oneself. Okay, so I'd like to share a case study that is in my book. This is actually a shorter version of it, but I wanted to share this because it really illustrates what we're talking about today. And this is the story of Jason. Jason is in his early 30s and has been going to 12-step meetings for sex addiction for 2 years. In general, he's doing much better in his life, but he doesn't feel emotionally sober in spite of working the steps with a sponsor and using the tools of program. Growing up in a wealthy family, it may appear that Jason had everything, but most of the time, Jason was left with a nanny, leaving him starving for love and attention from his parents. When he went away to boarding school, he found out that his father had multiple affairs, and then his parents went through a messy divorce. As a teen, he was moody and suicidally depressed, and that's when he discovered porn. Jason found a way to temporarily avoid the pain through excessive masturbation. He had no idea that pornography would become so intoxicating, and before he knew it, he was using porn many hours each day. It's been more than 15 years since Jason first found porn. He's now been sexually sober for 18 months, and his longing for a deeper connection is stronger than ever, which feels exciting but also terrifies Jason. Having been emotionally abandoned at such a young age, in addition to all of the secrets and lies surrounding his father's infidelities, trusting others was a serious risk. He realizes now that relying on reliable people is essential to live a life with emotional sobriety. After 9 months working with me as a client in my therapy practice, Jason is learning to identify and express his feelings more honestly and more directly. He's been using the emotional sobriety skills at home and feels more equipped to deal with life on life's terms. As a result, he's feeling more comfortable in his skin. Although in some ways, Jason has barely left the starting gate, he does envision a calmer, more grounded future, an internal experience that he's never known before. So, just to clarify, Jason is not an actual client. It's more like a compilation of clients, but it does illustrate the kind of clients that I see in my practice and what we're working towards in terms of emotional sobriety and connection and being most defended against their greatest needs, et cetera, et cetera. But so much of my work, I believe, is about the relationship in the room with my clients, because if they can establish some kind of trust and to feel safe enough with me and to start to look at what would it mean to really practice the 4 Rs? What would it mean to really hold emotional sobriety as almost like a transitional object between our sessions? Then hopefully, little by little by little, and sometimes it's gradual, there'll be more of a sense of hope and a sense of expansion in one's life. So that's the story of Jason. So what I want to say about emotional sobriety, sort of in summary, is that the substance or the behavior has to go first. In other words, someone has to be sober and clean and sober in whatever shape or form their addiction is dealing with before they can really work on emotional sobriety. It's virtually impossible. I've never run into anybody who is still acting out sexually or still using in some form or another who was able to really practice emotional sobriety. So sobriety comes first, then comes emotional sobriety. Like I said a moment ago, the 4 Rs are really a practice. And it's something just like brushing our teeth. How do we infuse it into our daily routine? Hopefully, as I keep saying, it is a way to reduce one's vulnerability to relapse. And the last point is that emotional sobriety is not just for addicts. It's not just for those in recovery from compulsive sexual behavior. Emotional sobriety is something that everybody can benefit from. And I almost want to come up with a new term. I'm not sure how that would work, but that wouldn't even be about sobriety, but what would be about well-being. And so it works whether a client is in addiction recovery, but it works for any client, and it certainly works in my life as well. Okay, so I wanted to put in a few slides about the nervous system and about the regulation of the nervous system. And some of you may already be familiar with this slide, some of you may not, but I'm going to share something about this because this particular slide is probably one of my favorite things to go over with clients. I would say that most, if not all of my clients see this handout, this particular diagram, at one time or another in my office. And the reason I like it so much is because I think it's a visual that we all can relate to, okay? So there is one thing missing, and I'll tell you in a moment where that is. But if you see the 2 dotted lines, right? In between the dotted lines is where we feel most regulated, most resourceful, and most resilient, okay? That is the area inside of us that hopefully we can come back to again and again and again when we get dysregulated, okay? So we're human, and all of us get dysregulated pretty much on a daily basis, sometimes a little bit and sometimes a lot. But if you look above the dotted line, what you're going to see is something on the right that says stuck on high, or the accelerator is on. So imagine that your nervous system has an accelerator and it's revving too high, right? Just like a car, it's revving too high or maybe really high. And when that happens, that's generally when we feel highly anxious, maybe even getting panic attacks, where we feel irritable, restless, rageful, etc. And we all dysregulate into this area at one time or another. There's nothing wrong with dysregulation. I want to make that clear. But the challenge is, how do we come back to a more regulated state more efficiently? And the same thing goes for, so the other thing about going up is we sometimes call that an up regulation. So if we're here most of the time, then that's an up regulation, right? And then if we go down, it's a down regulation. So sometimes the brake is on and we get stuck on low, right? Maybe the engine's not quite revving enough. And that's where we feel depressed, sometimes disconnected or dissociated, sometimes even numb, shut down, or just depleted and exhausted. And that's when the nervous system is downregulated. So again, it doesn't matter whether we're talking about an upregulation or a downregulation. We're talking about being able to find our way back to a regulated state more efficiently. And to the right of the dotted lines, there's an expression that they call the window of tolerance. I actually call it the window of resilience because I prefer using the positive version, but either way, the window of tolerance or the window of resilience is something that as somatic therapists, we're working with our clients all the time. So whether we're doing brain spotting or somatic experiencing or EMDR or any of the other fantastic somatic approaches out there, as somatically trained therapists, we're helping our clients build somatic awareness and find ways over time to really find their way back more efficiently. And by the way, this particular slide, I adapted it, but it came from one of my favorite trainers. Her name is Elaine Miller-Karras, who's here in Southern California, and she has a wonderful institute called the Trauma Resource Institute. And you can look it up either as Trauma Resource Institute or Trauma Resource Model. And she's fantastic. Her institute goes to natural disasters all around the world, helping out. And she does trainings here in Southern California, and I'm sure online nowadays. Okay, so that's the regulating the nervous system. So I say that sex addiction is actually a misfired attempt to regulate. So it's an attempt really to regulate the nervous system. It sounds kind of backwards, but addiction in general and sex addiction specifically is really an attempt to try and regulate, because someone might be feeling awfully depressed or they might be feeling awfully anxious, but whatever they're doing is they're trying through the activity, through the substance or whatever things they choose to use. It's an attempt to regulate the nervous system, but it's a misfired attempt because it helps initially, like there's some immediate relief, but it's not sustainable. And that's really what addiction is all about, is it's an attempt to regulate the nervous system. So I always say that it's actually an attempt to try and feel better, to try maybe to feel less, or to sometimes try and even feel more, depending on what the baseline is. Okay. So this always regulates my nervous system. So this is Bowie, and Bowie is our Cocker Spaniel mix, who is about 6 or 7 at this point. And what I wanted to illustrate with this particular slide is, in this moment, maybe this is happening for you too, because he's awfully cute, is that mutual regulation is really one of the gifts of long-term addiction recovery, that when we have people or pets that are completely dependable, that have our back, that are just there, that we can count on them, that mutual regulation, right? Because I think I regulate Bowie's nervous system. He was a rescue, by the way. He came from a shelter, and he was scared. We think he was very neglected. He wasn't abused in the classic sense, but we think he was very neglected. And when we met him, he didn't want to come too close to us. He was really a loner. And through the years, we've had him for since 2016, he's become much more interested in being with us. He's not a cuddly dog, believe it or not, but he's very interested in being close to us. But he regulates the distance just like we do. And that's really important, that with our clients, they regulate the distance and they find their way closer to us, or they go further away. It's up to them. And just like Bowie. And I think mutual regulation is really a gift between two entities. So Bowie and I have had the opportunities these last few years to regulate each other. And so that's why I wanted to introduce you to him. So I'm going to open it up for questions in just a couple of minutes. So if you have any questions that you haven't put on your Q&A box, feel free to do that. But I just wanted to say briefly about my book, since I keep referring to it. It came out last year, and it's called It's Not About the Sex, Moving from Isolation to Intimacy After Sexual Addiction. And the reason I wrote it was because I've been in the 12-step rooms, I've been in the therapy rooms for almost 3 decades. And there's still a lot of suffering out there. And like I said before, as much as we know, we don't know. And I'm really humbled to the idea of what is it that's truly going to make the difference for long-term sustainable recovery, whether that be addiction or in general, or whether that be sex addiction or compulsive sexual behavior. And so I really just brainstormed and said to myself, well, what are the things we're not talking about in the 12-step rooms? And what are the things that we could talk about more in the therapy rooms? And so the themes of the book are emotional sobriety, grief, shame, narcissism, regulating the nervous system, cultivating contentment, codependency and boundaries, relapse, and specifically the idea that relapse is natural and it's how it gets dealt with, that it's something that should not be stigmatized, but really is a learning opportunity. So anyway, I just actually have to say I have been really pleased with the response on the book. And a few years ago, I also wrote I self-published a workbook called From Now On, 7 Keys to Purposeful Recovery. And so on a personal and professional level, this is really my passion, and it's really something that I feel we all are learning together. And so with that said, I'm going to ask Jesse to help me here and start to see if there's any questions in the Q&A box that I can address, so that we can spend the last few minutes just answering some questions.
Thank you, Dr. Susskind. The first question we have is, would daily affirmations help with emotional sobriety?
I love that question. I'm going to answer it by saying absolutely. Many of you are familiar with the Page-A-Day books, which are the books out there, often in recovery sections, but often in general, where they'll have a quote at the top and a short story and then an affirmation at the bottom. And I've been using the Page-A-Day books since I started in recovery myself. And the thing that I love about affirmations is that it's that repetition of what's right and what rather than what's wrong. And so in neuroplasticity, as we know, the neural pathways are always listening to what we say, what we do, and what we read. And so affirmations are a way to really develop new pathways, new neural networks that are positive and affirming. So absolutely, I'm so glad you asked the question.
Perfect. And right now we don't have any other open questions. So at this point, I'd like to invite everyone to ask any questions you might have. And while we're waiting for that, Dr. Susskind, if you wouldn't mind just going over how everyone can contact you one more time.
Of course. So I'm always available for any questions or anything that you think I might be available to help out with. I've been practicing in Southern California, here in Los Angeles, since the early 90s. So even if I don't know the answer to something, I usually know resources around me that do. So on this screen, the contact screen, the best way to reach me is actually through my website, which is simply westsidetherapist.com. The email is very easy. It's andrew@westsidetherapist.com. And I'll just add that I have a blog, I have a podcast, I have various resources and things on my website which might be of interest to you. And so you can access my podcast, you can access my blog, you can access lots of things directly on the website, and you can also email me through my website.
All right, still no open questions. Would you like to launch the poll?
Sure. So I just want to thank Jesse again for being so helpful last week. Jesse O'Donoghue from C4 Events really stepped in and helped calm my nerves, helped regulate my nervous system. And so it's been really easy being part of this webinar. And if all of you would it would just take about a minute. There's 5 yes and no questions to stick around and complete a short poll about today's webinar. It helps C4 Events improve what they're doing. It helps me improve what I'm doing. And that would be a terrific thing. It literally will take you about a minute or so. And more than anything, I just really appreciate your time and your willingness to be here today and to be a part of our experience virtually. It really means a lot to me that you would show up and be a part of our time together. Thank you so much.